Introduction to Emotionally Focused Therapy, EFT. Emotionally Focused Therapy, EFT, is a therapeutic approach developed in the 1980s by Dr. Sue Johnson and Dr. Les Greenberg. Rooted in attachment theory, EFT emphasizes the importance of emotions and relationships in human functioning. It is widely recognized for its effectiveness in improving relationship dynamics, particularly in couples therapy, but it is also applied in individual and family therapy contexts. This paper will explore the origins, principles, techniques, and applications of EFT, as well as its empirical support in future directions. Origins and development of EFT. Historical background. The development of EFT was influenced by various psychological theories and therapeutic practices, including 1. Attachment theory, developed by John Bowlby. Attachment theory posits that early relationships with caregivers shape an individual's emotional and social development. Bowlby's work highlighted the importance of secure attachments for healthy psychological functioning. 2. Humanistic therapy. Humanistic approaches, such as Carl Rogers' person-centered therapy, emphasize the importance of empathy, acceptance, and the therapeutic relationship in facilitating change. 3. Experiential therapy. Influenced by the work of Fritz Perls and Gestalt therapy, experiential approaches focus on the here and now experience and the therapeutic process as a way to access and transform emotions. 4. Systemic therapy. Systemic approaches, such as family therapy, consider the influence of relational systems and patterns on individual behavior and emotions. Development of EFT. In the early 1980s, Dr. Sue Johnson and Dr. Les Greenberg began collaborating on the development of a therapeutic approach that integrated these influences. They aimed to create a structured, emotion-focused intervention that could address the complex dynamics of intimate relationships. Their work led to the formulation of EFT, a model that emphasizes the identification, expression, and transformation of emotions within the context of secure attachment relationships. Core principles of EFT. EFT is grounded in several core principles that guide the therapeutic process. 1. Attachment bonds. EFT views emotional distress and relationship problems as stemming from disruptions in attachment bonds. The primary goal of EFT is to help individuals and couples create and maintain secure, supportive attachments. 2. Emotional experience. Emotions are seen as essential to understanding and resolving relational issues. EFT emphasizes the exploration and transformation of emotional experiences as a pathway to change. 3. Systemic perspective. EFT recognizes that individual behaviors and emotions are influenced by relational systems. Therapy focuses on changing negative interaction patterns and fostering positive cycles of interaction. 4. Empathy and validation. The therapeutic relationship is characterized by empathy, acceptance, and validation. The therapist creates a safe and supportive environment where clients can explore their emotions and experiences. 5. Process-oriented. EFT is a process-oriented therapy that emphasizes the importance of the therapeutic process itself. Change occurs through the unfolding and transformation of emotional experiences within the therapeutic context. The EFT process, stages and steps. EFT follows a structured process that unfolds in 3 stages, each consisting of specific steps. Stage 1, de-escalation. 1. Step 1, identify the relational conflict issues. The therapist works with the couple to identify the specific issues that are causing distress in their relationship. 2. Step 2, identify the negative interaction cycle. The therapist helps the couple recognize the negative patterns of interaction that maintain their distress. 3. Step 3, access underlying emotions. The therapist guides the couple in accessing the vulnerable emotions that underlie their negative interactions. For Step 4, reframe the problem in terms of the negative cycle. The therapist reframes the couple's problems as a result of their negative interaction cycle and their unmet attachment needs. Stage 2, restructuring the bond. Step 5, promote identification with disowned needs and aspects of self. The therapist helps each partner identify and express their unmet attachment needs and vulnerable emotions. Step 6, promote acceptance of the partner's experience. The therapist facilitates the process of each partner accepting and validating the other's emotional experience. Step 7, facilitate the expression of needs and wants. the therapist encourages each partner to express their attachment needs and desires in a way that promotes connection and responsiveness. Stage 3, Consolidation and Integration. 8. Step 8, New Solutions to Old Problems. The therapist helps the couple develop new ways of interacting that address their relational issues and meet their attachment needs. 9. Step 9, Consolidate new positions and cycles of attachment behavior. The therapist supports the couple in consolidating their new interaction patterns and maintaining their secure attachment bond. Techniques and interventions in EFT. EFT employs a range of techniques and interventions to facilitate emotional exploration, expression, and transformation. Some key techniques include: 1. Emotionally focused interventions. These interventions are designed to help clients access and transform their emotional experiences. Techniques include: evocative responding. The therapist uses open-ended questions and reflective listening to help clients explore their emotions. Empathic conjecture. The therapist makes educated guesses about the client's underlying emotions and attachment needs. Heightening. The therapist amplifies the client's emotional experience to deepen their emotional engagement. Reframing. The therapist helps clients reframe their problems and experiences in terms of attachment needs and emotional responses. 2. Systemic interventions. These interventions focus on changing negative interaction patterns and fostering positive cycles of interaction. Techniques include: tracking. The therapist observes and maps out the couple's interaction patterns. Reframing the cycle. The therapist reframes the couple's negative cycle as a pattern that maintains their distress and unmet attachment needs. Enactments. The therapist guides the couple in practicing new ways of interacting that promote connection and responsiveness. 3. Experiential interventions. These interventions emphasize the here and now experience and the therapeutic process. Techniques include: empty chair technique. The therapist uses an empty chair to help clients engage in a dialogue with a significant person or part of themselves. Two-chair technique. The therapist uses two chairs to facilitate an internal dialogue between different parts of the client's self. Imaginal rescripting. The therapist guides clients in imagining and rescripting past experiences to resolve emotional distress. Applications of EFT. EFT is primarily known for its effectiveness in couples therapy, but it has also been adapted for use in individual and family therapy. Some key applications include: 1. Couples therapy. EFT is widely recognized as one of the most effective approaches for improving relationship satisfaction and reducing relationship distress. It is used to address a range of issues, including infidelity. EFT helps couples rebuild trust and create a secure attachment bond after an affair. Communication problems. EFT addresses negative interaction patterns and fosters effective communication. Emotional distance. EFT helps couples reconnect and strengthen their emotional bond. Conflict resolution. EFT promotes understanding and resolution of relational conflicts. 2. Individual therapy. EFT for individuals, also known as emotionally focused individual therapy, EFT, focuses on helping clients explore and transform their emotional experiences within the context of their attachment relationships. It is used to address issues such as anxiety and depression. EFT helps clients understand and transform the underlying emotional and relational issues that contribute to their anxiety and depression. Trauma. EFT provides a safe and supportive environment for clients to process and heal from traumatic experiences. Self-esteem. EFT helps clients develop a secure sense of self and improve their self-esteem. 3. Family therapy. EFT for families, also known as emotionally focused family therapy, EFT, focuses on improving family dynamics and strengthening family bonds. It is used to address issues such as parent-child conflict. EFT helps parents and children understand and address the underlying emotional and relational issues that contribute to their conflict. Adolescent issues. EFT provides a supportive environment for adolescents to explore and express their emotions and develop secure attachment relationships with their parents. Family communication. EFT promotes effective communication and understanding within the family system. Empirical support for EFT. EFT is supported by a substantial body of empirical research that demonstrates its effectiveness in improving relationship satisfaction and reducing relationship distress. Some key findings include: 1. Efficacy in couples therapy. Numerous studies have demonstrated the efficacy of EFT in couples therapy. Key findings include: improved relationship satisfaction. EFT has been shown to significantly improve relationship satisfaction and reduce relationship distress in both clinical and non-clinical populations. Long-term effects. The positive effects of EFT have been found to be maintained over time, with follow-up studies demonstrating sustained improvements in relationship satisfaction. Cross-cultural validity. EFT has been found to be effective across diverse cultural and ethnic groups, demonstrating its cross-cultural applicability. 2. Efficacy in individual therapy. Research on EFT for individuals has shown its effectiveness in addressing a range of emotional and relational issues. Key findings include: reduction in anxiety and depression. EFT has been shown to significantly reduce symptoms of anxiety and depression. Improvement in self-esteem. EFT has been found to improve self-esteem and promote a secure sense of self. Healing from trauma. EFT has been shown to be effective in helping individuals process and heal from traumatic experiences. 3. Efficacy in family therapy. Research on EFT for families has demonstrated its effectiveness in improving family dynamics and strengthening family bonds. Key findings include: improved parent-child relationships. EFT has been shown to improve parent-child relationships and reduce parent-child conflict. Enhanced family communication. EFT has been found to promote effective communication and understanding within the family system. Support for adolescents. EFT has been shown to provide valuable support for adolescents in developing secure attachment relationships with their parents. Future directions in EFT. As EFT continues to evolve, several future directions are emerging that aim to expand its applications and enhance its effectiveness. Some key areas of focus include: 1. Integration with other approaches. There is growing interest in integrating EFT with other therapeutic approaches to enhance its effectiveness. Some areas of integration include: mindfulness-based interventions. Integrating mindfulness practices with EFT to enhance emotional regulation and present-moment awareness. Trauma-informed approaches. Incorporating trauma-informed principles into EFT to better address the needs of clients with complex trauma histories. Neuroscience. Integrating findings from neuroscience to deepen the understanding of the neural mechanisms underlying attachment and emotional processes. 2. Technological innovations. The use of technology in therapy is expanding, and there is potential for incorporating technological innovations into EFT. Some possibilities include: teletherapy, providing EFT via teletherapy to increase accessibility for clients who are unable to attend in-person sessions. Digital interventions, developing digital tools and apps to support clients in practicing EFT techniques and skills outside of therapy sessions. Virtual reality, exploring the use of virtual reality to create immersive therapeutic experiences that enhance emotional engagement and transformation. 3. Expanding applications. There is potential for expanding the applications of EFT to address a wider range of issues and populations. Some areas of expansion include: workplace relationships, applying EFT principles to improve workplace relationships and address issues such as workplace conflict and burnout. Community interventions, developing community-based interventions that use EFT principles to strengthen social bonds and promote community well-being. Health-related issues, applying EFT to address the emotional and relational aspects of health-related issues, such as chronic illness and health behavior change. Conclusion: emotionally focused therapy, EFT, is a powerful and effective therapeutic approach that emphasizes the importance of emotions and attachment relationships in human functioning. Developed by Dr. Sue Johnson and Dr. Les Greenberg in the 1980s, EFT has become one of the most widely recognized and empirically supported approaches for improving relationship satisfaction and reducing relationship distress. Grounded in attachment theory, EFT focuses on helping individuals and couples create and maintain secure, supportive attachments through the exploration and transformation of emotional experiences. EFT follows a structured process that unfolds in 3 stages: de-escalation, restructuring the bond, and consolidation and integration. The therapeutic process is guided by core principles, including the importance of attachment bonds, emotional experience, a systemic perspective, empathy and validation, and a process-oriented approach. EFT employs a range of techniques and interventions, including emotionally focused, systemic, and experiential interventions, to facilitate emotional exploration, expression, and transformation. EFT is primarily known for its effectiveness in couples therapy, but it has also been adapted for use in individual and family therapy. It has been shown to be effective in addressing a wide range of issues, including relationship distress, anxiety and depression, trauma, self-esteem, parent-child conflict, and family communication. Empirical research supports the efficacy of EFT, demonstrating its effectiveness in improving relationship satisfaction, reducing relationship distress, and promoting emotional and relational well-being. Future directions in EFT include integrating EFT with other therapeutic approaches, incorporating technological innovations, and expanding its applications to address a wider range of issues and populations. As EFT continues to evolve, it holds great promise for helping individuals, couples, and families create and maintain secure, supportive attachments and achieve greater emotional and relational well-being. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.